the KellumMD.com video podcast where Dr. Kellum and I talk about topics, health and wellness, life, love, pursuit of happiness.
Why do you make it weird?
All of them, I think, all of those descriptive words, I think, are substantive to our topic today.
Yes.
Hormone, right?
I totally agree.
Life, love, pursuit of
happiness.
happiness.
To get to the point, but
boom,
yeah, but,
boom,
yeah, but,
boom.
Yeah.
I literally saw. And we're talking about hormone replacement therapy, something that you've done for a while.
Right.
I'm over a decade, maybe you've been doing this?
For sure. It's been a while. And really the advances in hormone therapy over the last 6 or 7 years have been quite amazing. In particular, our pellet therapy that we do. It makes a difference. It changes lives. It's a great preventative therapy. And we're very proud it's really changed our practice.
Yeah, and for those of you that have gotten the procedure, you know that it does make you feel better. It does give you an invigorated feeling. But there are, more so than the energy, more so than, things like a higher libido. These things actually have a health and wellness component that can improve the quality of your life.
Absolutely. And I think that's really where we're getting terms.
Yeah.
The evolution of knowledge with hormone therapy is really kind of amazing, in my opinion. Before when we first started, we used it for lifestyle improvements, fatigue, libido, those types of things. But really where the benefit comes and what we get excited about as preventative care doctors is the cardiovascular benefit, the bone density improvement, the decreased risk of improvement in breast cancer risk reductions that we see associated with that. And there's this the whole body improvement that comes associated with that, not just how you feel, but how you live in terms of wellness and aging and all that kind of stuff. That really does make a difference for individuals.
And we do them at all the clinics. We do them here. We do them in Bergheim. We do them there at Westover Hills. As we continue to grow, this is a big part of our health and wellness expansion for Kellum.
Absolutely, and it's a necessary component of that expansion as well. And hormone therapy, specifically for those that don't necessarily know what we're talking about, it's really testosterone replacement, both in men and women, and estrogen replacement in women. And what we notice in men and women that over time we see diminishing levels. So people will feel fatigued, tired, run down. We do a battery test here in our office at Kellum Family Medicine that really identifies those shortcomings for individuals. And then we tailor a specific treatment for the individual so that we can optimize hormones, both thyroid as well as testosterone and or estrogen as we need to, and really curtail it to the individual, maximizing and optimizing their hormones and their quality of life associated with that. And secondary to that, we get a tremendous benefit in their preventative care.
And it's funny because this might be a little off topic, but I was interviewing Jen Zaragoza about her approach to aesthetics and wellness and Botox and fillers. And she doesn't just say, come on in, let me remove that crow's feet.
No, she doesn't.
She wants to take a holistic approach at how she handles it. And it's the same thing with what we do. It's the same premise for our wellness, for our health, at how we look at our patients. And that is one of the therapies that you use to create this holistic realm of health and wellness.
Absolutely. And to Jen, she's an awesome nurse injector that we have here. It's sort of how we...
She's sassy. She's a little sassy.
Yeah.
That's all I'm going to say. Please continue. I digress. Please go on.
I'm not commenting on that because she's sassy.
A little bit, yes.
No, but it's sort of the natural extension that we look at, right? When you really heal the inside or make it as good as you possibly can, the natural extension is looking better on the outside. And so, that holistic approach is really what she does. And I think what we do well here at Kellum Family Medicine, and we're never here to speak bad about anything, but I would caution people when they go to locations that specifically look at hormone therapy and just sort of drive the business through there. Hormone therapy should not be something that you do on the side and just do to feel better. It really should be a part of your whole body approach of preventative care. And that's where I think that should go through your primary care, specifically your family medicine doctor here at Kellum Family Medicine, because it's an integral part of your overall health care. And it should not be something that you just do on the side. And so, that's something that we're passionate about. We never, again, would speak bad about any locations. However, that should be a consideration that everybody has when they look at hormone therapy for themselves.
And I've been doing this for some time, since you've been my provider for almost 20 years now. And when you started the technology, I started using it instantly. Started feeling great, and it's something that I've continued. But what I've seen is not only is the technology of the actual therapy improved, it's everything from how you place the pellets, the type of pellets that you're using. It's a far less painful, because you used to put it on one of the buttocks, the butt cheeks, I guess. What's the medical term?
The gluteus.
The globulus? Did you call it a globulus?
Yes.
Okay. I would put it on my right butt cheek. And when you sit, you got a little incision, you have the balancing nerves. Now they've changed that to where now I put it in my flank or my love handle or my long however you want to talk about it, because I guess I have plenty of room down there. But the pain of it is, the discomfort, at least on the location of placement, has improved.
Absolutely, and the technology. So what we're talking about is a bioidentical hormone. So it's either testosterone in the pellet or it's an estrogen pellet that we place in that area. That pellet is absorbed, what we call with cardiac output. So when people increase their exercise, their heart rate goes up because their heart is pumping more blood to their extremities. That's how that dissolves, and that technology has gotten better over the time. The placement, what we found is when we place it in the flank area, it really does make a difference because it doesn't get impacted by sitting on it, moving.
Basic things like sitting,
Exercise doesn't get inhibited, but more importantly, what we're seeing is the extrusion of the pellet out of the body doesn't happen near as often as it used to be when we placed them in the gluteal area. So over time, we've understood and learned where optimum placement are, as well as optimum dosing, and it really does make a difference when you're in the hands of someone who's been doing it now as long as we have.
Yeah, and really, it's again the evolution. You guys have gone along with that evolution to improve this process for maximum patient output.
Absolutely, and that's what we're about here at Kellum Family Medicine for sure. But it really does change lives, and it makes a difference, and it gives people a feeling of how they should feel, not necessarily how they do feel every day. It makes a big difference with that, and so we encourage people to look into that.
And every one of the providers that we have, they do just a fantastic job of providing that. Little Art Camps has got to get a stool to get up to get it, reach that high up, but other than that, I mean, they're all. I love you, Art. They're all fantastic. They really are at what they do.
Yeah, they're very well knowledgeable and very well versed in hormone therapy, and so that's one of the things that we do so much here. That it really is a passion for most of the providers here, and how they do it, how they place it, their outcomes. We're all very similar in our approach, minus Art because he's got small hands.
Yeah. Well, and again, I know we're picking on him because he's our buddy, but he is a tremendous provider here, and one of the very best, I think, in all of the state of Texas at what he does.
I wouldn't disagree. I mean, he's been here now coming over a decade, and I've been doing this almost 30 years, and I would have him see me and my family any day of the week.
Didn't like me calling him little cutie pie, though. I had to stop after about, look at the little cutie pie. He did not like that at all, did he?
No, I think he probably did.
Yeah, well, he called me Gabs for, I don't know, like a year, and the tears have finally gone away for that. No nicknames. How's that?
Fair.
All right. And Dr. Kellum, you can call the office, 210-945-2121, or visit our new website, kellummd.com. If you want more information on that, visit our site. But come on down. And if you're thinking about getting it, if you haven't been a patient of ours, come on down, get a consultation, talk to Dr. Kellum or any of the providers on the benefits of this technology.
Absolutely. We'd love to have you come on in. We'll get you in. We'll do a complete look at where your health is at, evaluate things, explain where we're at with things, and certainly can lay out a process that I think would be beneficial for everyone.
That's for hormone replacement therapy or any of the fantastic medical services that we provide here at Kellum Family Medicine. Dr. Kellum, we're getting closer to Christmas.
Okay.
You got your Secret Santa? Did you ever pick your Secret Santa person?
It's a secret.
Well, I know. I'm not asking you for the revelation of said
I do.
secret person, but what are you going to get said secret person? Have you thought about that yet?
It's a secret.
That tells me you have no idea what you're going to do.
Totally secret.
You're like, yes. All right, guys, that's going to wrap up this edition of the KellumMD.com video podcast for Dr. Daniel H. Kellum. I'm Gabe Farias. Folks, stay healthy.